Now, we have a very special guest that I'd like to bring up, and that is Jim Crounce. Jim is the chairman of the National Committee to Preserve Social Security and Medicare. Pretty important, Social Security and Medicare, don't you think? And that organization has a mission to protect, preserve, promote, and ensure the financial security, health, and well-being of current and future generations of maturing Americans. As a strong advocate for these programs that transform the lives of seniors in our country, I am honored to have Jim join us today in our beautiful district, but specifically here at this beautiful senior center here at El Corazon in Oceanside. So with that, please join me in giving a big 49th District welcome to Mr. Jim Crounce.
I think I'm mic'd up with this. Is this
so they can
okay?
Here, use this.
Okay, I'll use this too. I'm delighted to be here with you today in Oceanside and with Congressman Levin. That number, I used to be a chief of staff on the House side many years ago and then on the Senate side. And I can tell you that number of town hall meetings is very impressive. Town hall meetings aren't what they used to be for a member of Congress. People are a lot more opinionated these days. And so for Congressman Levin to do that shows that he's listening and listening to everybody. And I think that's terrific. Congressman Levin is one of the strongest supporters in the Congress in terms of protecting Social Security and looking for ways to improve it and Medicare. In fact, we do a scorecard on all the members of Congress. And on the votes that we rate members of Congress on, Congressman Levin is 100% perfect. And you should be proud of that. And I can tell you in Washington, D.C., Mike is known as a smart and very effective member of Congress. He's somebody who does listen to both sides. I know he's got a special focus on veterans, on climate change, and of course, the economy. Let me tell you a little bit about our organization, the National Committee to Preserve Social Security and Medicare. We're a national organization. We're member-based. We've been around for about 40 years with the sole mission of trying to preserve Social Security and Medicare and look for ways to make it even better. We lobby Congress on legislation that comes up affecting Social Security and Medicare. And then we also endorse members of Congress and candidates who share our view. I think it's kind of interesting to think about your neighborhoods here in the 49th District. 16.3% of the population here are seniors, so that's 65 plus. And we figure there are about 125,000 people in this congressional district who are on Social Security and Medicare. Our organization, we've got millions of people all over the country. We've got 3,500 members in this district. Is anybody here a member of the National Committee? You may, if you are, you get a lot of mail from us. That's one thing we're known for. And if you want to check out our website, it's a very good resource for Social Security and Medicare. It's NCPSSM.org, National Committee to Preserve Social Security and Medicare.org. It's quite a mouthful, but it's a great resource, and you can go on that website and virtually any question you have about each system you can get answered on the website, and you can find out what legislation is coming down the pike that you should know about. I think it's kind of important as we think about Social Security and Medicare, especially as we walk into this election year, that we think about why were these programs created in the first place? I know a lot of older people may know, a lot of younger people probably don't know. Social Security came about in 1935, and it was the brainchild of President Franklin Roosevelt. So this was during the time of the Great Depression. It was part of the New Deal, and Roosevelt saw how the Depression hurt everybody, but it especially hurt senior people and retired people. And he wanted to come up with a way to give people a kind of a guaranteed monthly benefit that they could count on. And that was the birth of Social Security. So it's been going pretty strong since 1935. Medicare was actually an idea that was kicking around the Eisenhower administration in the 50s. But it wasn't until 1965 that President Lyndon Johnson made it part of his war on poverty. The idea there was when people retired, they really didn't have their employer to provide health insurance for them. Some employers were more generous than others. Sometimes you could use this COBRA system. So he wanted to come up with a way to cover everybody over 65 with the health insurance program. And I think it was an ingenious idea. How many people are on Medicare? I know I am. And I think you could have some complaints about it. I think it's a very good system and really provides a level of care for seniors that's very important. Some people like to criticize these programs these days, but I think they're very important. And I think everybody has family or friends who have stories. I know in 1993, my dad died suddenly, and it's kind of a long story about what happened. He was a lawyer, and he got into a partnership battle, and yada, yada, yada. It was a terrible situation for my mom. And so when we talked to my mom, I've got a brother and sister, about her situation, the most important thing to her was, I don't want to be a burden to you kids. And I'll bet everybody here who's been in that situation knows exactly what I'm talking about. And thank God that Medicare and Social Security were there to help my mom. She was fortunate to have kids who wanted to pitch in too. Not everybody is. So if you think about it in those terms, you know how very important it is that these programs do well and succeed. Now, the threats to Social Security, especially right now coming into this year, are very real. Sometimes we go for years and we don't really hear much about it. We think everything's just copacetic and fine. And we think these programs are sacrosanct and untouchable. But what happens in this upcoming election this year is going to be very important. So you need to research the candidates if you care about these issues very carefully. Some of the threats that have been floating around for a while that I think we'll hear more, I think you're going to hear more about it this year, are to privatize Social Security and Medicare. Now, this privatization of Social Security is a bad deal. And it's basically, it would create private accounts that would gamble your money in the stock market. And, we can see just by the last couple of months with the economic situation how much it goes up and how much it goes down. And if you had to tie your guaranteed monthly benefit to that, I don't think you would feel much security. The idea to privatize Medicare is a big question mark as well. Most of the experts think it would raise premiums, not lower premiums. And so be careful of that one. That's a really bad deal. There are a lot of people who want to raise the eligibility age of Social Security and Medicare. And so pay attention to that. And just a couple of months ago, I think it was in March, Senator Rick Scott from Florida, everybody, he used to be governor and now he's a senator from there. He suggested, this is exactly what he said. He suggested that both Social Security and Medicare should be sunsetted. And sunsetted is a Washington, D.C. beltway term for ended, okay? So pay attention to that. This guy's a senator, he's an influential senator, and that would be a horrendous thing to occur. Fortunately, you've got a congressman who's 100% in support of keeping these programs strong and enhancing these programs. Let me tell you a few things that we especially love about Congressman Levin's record just this year and the last couple of years. Number one, trying to lower prescription drug prices. Earlier this year, Mike worked to help pass a bill in the House that would, it's called the Lower Drug Costs Now Act, which would establish prescription drug price negotiations, protect Medicare from excessive price increases, and establish an out-of-pocket limit for Medicare Part D enrollees. Now, this hasn't been taken up by the Senate. We think it will be taken up in a couple of weeks. Hopefully this will move down the pike and become law. We badly need it. A part of this bill that passed, that was Congressman Levin's bill, was increasing funding for the National Institutes of Health. Why is that important? Because they're the preeminent group in our country that does research on curing diseases. And so getting more money into research at NIH is a really good thing. And thank you for doing that. That's very important. And the other thing that is part of that piece of legislation is as you know, there's a lot of biotech in this part of California and pharmaceutical research, and it helps those companies too. So it was a really, really good thing that you did.
Thank you.
Social Security. There are a couple of bills that Congressman Levin is a co-sponsor of that relate directly to Social Security. The first one, it's the acronym in the House, H.R. 5723. It's called the Social Security 2100 bill. Now, that bill's got several provisions that would really help put Social Security on an even better footing. It would raise additional funds for Social Security. It would increase benefits. It would change the way that Social Security COLAs are figured every year, and to the betterment of you and me who were affected by it. It would repeal these unfair provisions. California is one of these states where public employees have this problem with Social Security, and it would get rid of that. Many other things to strengthen Social Security. And there's something also that Mike is a co-sponsor of with a Republican member from Illinois, Rodney Davis. And this, again, would address this situation that California public employees have with their Social Security benefits. So I'm going to wrap up, but let me just say this. Our organization has, I think, a great tradition dating back many years. And so, Mike, if you would come up here for a minute.
Oh, wow. This is great.
Well, what we've done for a lot of years is for people who are 100% fighting in Congress to protect Social Security and Medicare, we present them with boxing gloves.
That's great. Thank you. Thank you.
And we just want to wrap it up by saying thank you for being our champion.
Thank you so much. Thank you, Jim. Thank you, thank you, thank you. Can we give a big round of applause for Jim and the Committee to Preserve Social Security and Medicare, everybody? Thank you so much.